What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
What's up, everybody? It is Zach Baker, and I have got kind of a special episode today. We have both residents with us, Bami and Christian Huckfeldt. They are in this current cohort of our sports residency here at R2P. Our residency runs traditionally from September through September. So it's about a calendar year in length, which means we are just over the halfway mark here with the residency. And we just wrapped up applications for next year's cohort. And during the application process, I myself as the program director, our current residents, past residents, they commonly get asked, should I pursue a residency, or why did I pursue a residency, or what led you guys to doing a residency? And we've touched on this question a little bit online. I have some FAQs on our website that kind of allude to why it may or may not be relevant for you. We've done some shorter form videos hitting the big topics, but I thought it'd be nice just to put all of this together, hear all of our thoughts collectively, and be able to elaborate a little bit on it. And then we'll also dive into, now that we're 6 months into this thing, what's been a pleasant surprise, what's been some things that they've gotten from the residency that they didn't know they were going to get that much from. And then also, we'll kind of ask them the question on the spot, would you do it again? And what would you like to see now that you've lived through it? Ways that you think the profession in itself can enhance the residency curriculums. So, Christian, let's start off with you. What led you to pursuing a residency, and why did you think it was a good decision for you?
Yeah, definitely. I mean, for me, when I was finishing PT school, I was really looking for a specific type of experience, and an experience that included mentorship and clinical guidance and surrounding myself with individuals who, A, were a little bit smarter than I was, and B, just were willing to teach and were willing to explain so I could grow as much as I possibly could during the early parts of my career. So in all honesty, and I tell students this as well, I only ended up applying to one residency, and that was obviously R2P's, because I had looked at, obviously, R2P Sports Residency as well as a couple other jobs, and the experience that I was looking for, which, like I alluded to, a lot of good clinical mentorship, a lot of didactic knowledge and learning, and really just a good environment to grow clinically as a young clinician. This residency kind of hit and checked all of those boxes for me. So, in my opinion, it was kind of a no-brainer.
Yeah, and I think something that people need to be very honest with themselves about is what they are looking for in a residency program. And I don't think you even know what that answer is as a student or as a new graduate who's still considering residency until you actually reach out to programs and familiarize yourself with what that process is, what the structure is. All residency programs have common prerequisites that they need to hit, but there are different experiences that are unique to one that takes place in a private practice versus an academic setting, or one with a larger corporation that's the sponsoring organization. So I think what you'll find as you talk with different program directors, every program director wants an individual coming into their program that is seeking the things that they think their program does very well. And if things that you're looking for are something that we don't think we have vast experiences with that, or maybe we don't have faculty who can deep dive into that, or we just don't have the resources, then we are going to point you in the direction of a residency program that can hit that. Because ultimately, if you're going to be spending roughly a calendar year with somebody, you want all parties to be full in. You want everybody to have a great experience. And ultimately, residency and fellowship education was created to continue to just elevate the physical therapy profession in and of itself. And we can only do that if we're finding the right fits for people. So, Bami, do you mind just touching on why you personally were interested in a residency, and really what were kind of like your non-negotiables of what you wanted in a residency?
Yeah, so for me, I was really big on the mentorship. One of the things for me, like after graduation, I was really fearful to just stop learning after school, and I think your residency kind of gives you that extra year to kind of learn more and just be around people that are smarter than you, people that are kind of specialized in what you wanted to do. Also, another thing for me was that I love sports, and I knew for certain that I wanted to get into sports, but I also knew that there was a lot of loose ends I didn't fully know about sports PT. Getting into the residency, you're going to start to realize that treating a high-level athlete is a lot different than treating an orthopedic patient. And I think that when I was applying for residencies, I didn't understand exactly what I was looking for. I just knew that I wanted a mentorship, and I knew that I wanted to be in sports. And then I was a student at R2P, so applying for the R2P Sports Residency was kind of just a safe one for me because I already knew the philosophy. I knew how much they care about mentorship, and that was something that I kind of valued too. Looking back at it, going into residency, I think I wanted a residency that had connections with D1 sports. I think I wanted a residency that had a lot of like game coverage hours. And it's kind of funny enough, after being in the residency, I figured that this probably wasn't really what I wanted. Just from the standpoint of what we do here, I kind of like the flexibility of being able to have different experiences, whether it's professional or Division I or in different schools, rather than just being stuck in one school. But that's kind of why I got into residency, and that's what I was looking for at the moment. And then it kind of changed as I went through the last couple of months.
And I'm glad that you touched on the mentorship component because I think a lot of individuals leave school and they crave mentorship and they crave that structured, allocated time with somebody who has experience in the field, kind of guiding them through their early career. Now, I'm not going to be naive to think that you cannot get mentorship unless you do a residency. You can absolutely find ways to get great mentorship without going through a traditional residency program. I think the steps that you take in interviewing residencies themselves and finding out what that residency offers, you should do that as you look for a new job if you're not pursuing residency. And I know some individuals who work at different companies that are in charge of doing the mentorship and doing their staff development, and they do a phenomenal job of onboarding new PTs, getting them comfortable through their early career, and maintaining points of contact with them to make sure that they're fulfilling their career throughout their tenure. I am also well aware that there are companies out there that promise the world with regards to mentorship, but they cannot tell you how it's structured, who's going to do it, when it's going to happen. And then, what do you know? You're 2 weeks in, your schedule's busy, your mentor's schedule's busy as well, and you never actually have these meetings. So we at R2P, we got to a point with our company where we quickly realized we value education and we value the clinician experience from an onboarding and just from a hopefully career fulfillment standpoint as they continue through their career. And we started to realize unless you allocate time with this, it is not going to happen, which is kind of where my role within the company has shifted to where I actually have a day every week that's geared towards staff development and meeting with our staff, which, speaking candidly, if we would have never made that transition about a year and a half ago to allocate time to it, you just get to a point where you don't have enough hours in a day, or you do not have the ability to just make it consistent and structured and well thought out. So make sure that you're interviewing jobs just like you would with the residency. Now, Christian, going back to you, now that we have been here for about half a year, you've gone through the residency program. What are some things that have been kind of pleasant surprises to you in regards to kind of getting more than what you thought you were going to get, or something that you didn't really think was going to be of interest or high value to you that you're starting to realize, like, man, that's something that I'm really glad I was able to do or have that experience, or I just grew more in this area that I would have envisioned I would have?
Yeah, definitely. I mean, I came into residency knowing, and a lot of my friends, especially from PT school, will know this, but I enjoy teaching, I enjoy talking, I enjoy getting out in front of people and sharing knowledge. And to a certain extent, I also think that helps me learn, because if I am starting to disseminate information, I need to understand that information to a lot greater depth than if I just kind of understand it on my own. So I really sought out a program, and conversations that you and I had even before we started residency is how can we create these teaching and lecturing experiences to various different groups of individuals. So a lot of my lecturing kind of experience and what I'm interested in is more of the professional level. So PT students up into current clinicians, raising that aspect of it. But one thing I think you have done that has really helped me is you've challenged me and Bami as well to get out and teach and speak in front of individuals of all ages, of all experience levels, and the entire spectrum, everything from high school lectures to college, undergrad, to PT school, to post-professional as well. And so being able to create that same lecture and deliver it to 4 different age groups of individuals with different knowledge bases, with different experiences, and frankly, different interest levels has been really, really huge, I would say, for me, just learning to be able to change the way I speak and what I say to different age groups as well.
Yes, and for those that are unfamiliar, every month we have our residents do a speaking engagement, and they range from high school sports medicine classes to local strength and conditioning facilities where we interact with their strength and conditioning coaches. Some are more just general population of those strength conditioning facilities or of our patient population at R2P, some more community-facing as opposed to professional-facing. And then we also have them interact with DPT programs. So this year they've done lectures for UMES's DPT program and for Lebanon Valley's DPT program. They have done virtual Zoom lectures. They've also done in-person labs. We've gone down to the Naval Academy once, and we'll go down there for a second time next month, where we're actually going to be doing a return to sport workshop and seminar for their athletic training staff down there. And I think the unique part about this is it gives them an opportunity to have very low-risk ways to practice their public speaking and their teaching skills before they get in front of their own colleagues and people that may have more experience or more time in the profession that they do, and they feel a little bit more comfortable, more confident. And I think that also relates very well to patient care. So even if you have no academic interest or you have no public speaking interest, being able to communicate a similar message to a wide variety of populations is no different than going into your day and you have one person with low back pain, one person with a rotator cuff repair, one person's 10-year-old, another person's 50, another person's 80. You have to have different communication styles for people who resonate with different ways of interaction. I hope that's something that they are gaining from this. I'll also say residents just often leave PT school. So they're in high school, they go to undergrad, they go to PT school, then they go to a residency, and they're stuck in this learning mode of where they are always being taught all day long for the entirety of their academic career. I've found that they often lose sight of how much they actually know. And I think oftentimes they maintain this student mindset, which is great. We should never lose that mindset. But I don't think they give themselves enough credit. The 2 that I have on here right now, Bami and Christian, I've said the same thing about Samantha Curbello, who was our resident last year. And I think getting these opportunities to speak where they're not surrounded by residency faculty and people who have been in the game longer than they are, it allows them to realize, hey, I actually know what I'm talking about. And I fit in pretty well within this PT community in regards to where I actually fall with my experiences and with my knowledge. So it's always fun watching them speak and watching them talk and kind of come to that realization of like, hey, I'm pretty smart and I know what I'm doing and I'm getting more confident conveying that message. Bami, can you share your thoughts just now that you're 6 months into this thing? What have you really learned about yourself or just what has been enhanced and some different takeaways from the residency?
Yeah, I think a lot of things I like to, kind of what Christian said about public speaking. Every time you go up there, it gets a little bit easier. Still not easy yet. But I do like the public speaking and being able to teach because, like Christian said again, right, it gives you time to look at information on your own. And, there's no better way of learning the information or testing your knowledge and information than teaching it. Something else I do like about this residency program, too, is kind of just a lot of the the personal growth I've made. We do book club too, and I think that's one thing that's like we kind of overlook a little bit here, but I actually really enjoy it. The book club, it's like in the midst of, patient care, getting residency assignments done, and then outreach, and then the game coverage hours. It's like we're still required to do a book every quarter. And I like that because a lot of these books doesn't really have anything to do with patient care, but you could apply all of them to patient care. And I do like the fact that, we're still kind of reading those books and we're still having time to talk about it and digest it because it kind of helps you with your own personal growth. And then big thing, too, is with this residency is it kind of pushes you in ways that you probably wouldn't necessarily push yourself as, like, a new grad, right? I think as a new grad, you get caught up, like, new lifestyle, or you're treating 40 hours a week, so you probably don't have much time to do other things. I think the structure that we have set here, it kind of forces you to step out of your comfort zone a little bit. It forces you to do a course on the weekend. It forces you to, do more Con Ed courses. That's been the big thing for me is that you can't be lazy here. Right? It's going to call you out, and I kind of like that bit of structure for myself.
And I think another way to look at that as well, a lot of the things that you get within the residency program here and at other places like Bami had alluded to, you'll often at some point in your career probably have the opportunity to do that. But if we can condense maybe 10 years worth of opportunities into your first year out of school, you get all those experiences front loaded. You get to learn more about yourself outside of patient care. What really drives me? What do I like to do? Do I like being involved in the community? Do I like doing more of the academic side of things? Do I like being more involved with the sports venue coverage? It helps you early in your career identify things outside of patient care of what you enjoy doing, which I think is huge for career fulfillment. The other thing that Bami alluded to is it teaches you how to manage time. And we have a lot of things outside of patient care that the residents are required to do, which I would argue when you finish residency, a lot of those things are no longer going to be parts of your day-to-day occupational roles. So your overall work demand probably in some respects is going to decrease when you leave residency. And it'll almost feel like a weight lifted off your shoulder where it's like, oh gosh, all I have to do now is just treat patients. I just have to treat patients and cover, this game or this practice, or wherever your career takes you. But hey, I don't have to worry about the educational curriculum. I don't have to worry about studying for boards. I don't have to worry about getting my sports venue coverage hours. I don't have to worry about book club. I don't have to worry about journal club. I don't worry about prepping my end of year in-service. I don't have live patient exams that I need to get ready to review. All of these extra things that are part of your daily week are no longer going to be part of that week when you finish residency. So I think it is something where you can get a lot of experiences front-loaded, get the personal and professional growth from that, help that shape how you want to allocate time in the future. And if you can get through the first year of residency, I think after that, you've developed a lot of skills and habits that are going to serve you well the rest of your career. So now the million-dollar question for each of you, Christian, looking back on it so far, would you pursue residency again?
Yeah, absolutely. I mean, like I had said, for me, I sought out an experience that I thought would tackle a few different personal goals of mine. One of my favorite parts about this residency and kind of this company in specific is their ability to morph a little bit to my goals and what I wanted to accomplish. And it's conversations that you and I have had behind closed doors, and you've said, what do you want to get out of this? When you leave residency in 12 months from now, what do you want to say that you have accomplished? Or what experiences do you want? And it's conversations like that you and I and Bami as well have set up different teaching experiences, different lecturing experiences. One thing that you and I had conversations on early on is that I wanted to experience in the high school training room, but kind of high school, college, professional as well. Well, we spent time at a local high school. We spent time in a Division III training room, a couple Division I training rooms, and we've had a couple experiences in professional levels as well, in addition to a couple gymnastics events and a couple CrossFit events. So we've really gotten to see things along the big spectrum. So for me, it's an absolute no-brainer. It's just having the ability to gain all of these experiences early on in a structured but flexible enough way in that if we need to make a change because we want a different experience, it's only the three of us. We only have 3 schedules to plan, and we can kind of adjust on the fly as needed.
Yeah, and I think that's, there's certain things that we have to do just from a requisites, from an accreditation standpoint, but we have flexibility with how we gather those hours and those experiences, and we have some flexibility based off individuals' own career goals into how we shape what those experiences look like. So, Bami, 6 months into this thing, are you leaving tomorrow? Are you coming back? What are you doing?
I'll be back tomorrow. But no, I think Christian hit the nail on the head there. Big thing for me was it definitely exceeded expectations. I think the cool thing is having so many touch points with you, Zach. Honestly, I think the cool thing is you're kind of asking, what do you guys want to get out of this? I said, hey, I want to go see pro soccer. You're like, all right, you set it up with DC United. I think to me that's the cool thing. I'm not sure how other residencies are ran, but the cool thing is that we it kind of feels like all 3 of us are in this together, and it's not just Zach telling us what to do, but we all kind of get to get what we want to get out of it. I think another big thing, what makes it exceed my expectations, are just kind of alluded at it before, the different things we get to do 1 year out of school that might have taken 10 years, right? Just being in the same room with certain people, being able to speak at certain events, I think that's huge. So I think I didn't really kind of think about that getting into residency. I'm sure when we sign up for residency, we all think we know we're going to get out of it, but we don't always get what we want out of it, or we don't even know what we're trying to get out of it. And now looking back at it 6 months, I was like, man, I didn't even know half these things were actually going to happen. And looking back, I'm like, that's pretty cool, right? Certain things that, I've reached even 10, 15 years into the profession, and we're able to kind of get it out 6 months into this residency.
It doesn't really hit you until, so for people to make them aware, at the end of every month, and what we did earlier today is we track our progress and make sure that we're hitting all of the different requisites for the completion and successful graduation. So we have to look back and what did we do from a community outreach standpoint? What did we do from a curricular standpoint? What sports venue experiences have we had? And in the first couple months, you're accumulating and you're getting your feet wet, you're getting the experiences. Now we have 6 months of data to look back on. It's kind of wild. It's like you guys have done, in the last week, you did 3 DPT school lectures and labs. So that's something, I had never done that in my career prior to residency. And if I was not involved in residency, I probably would have never been even invited or considered to have that opportunity. You guys have been involved with, like you'd mentioned, high school, Division III, Division I, some local community events, youth and adult from a sports venue coverage standpoint. So having all those different experiences, and that's to each their own. Some people love that variety. Others know exactly what they want to do, and they do want to be fully immersed in one specific setting with that. But it's kind of cool just looking back 6 months, like what all have we actually accomplished? And it's starting to mount, and it's only going to get more and more significant over the finality of this residency. Christian and Bami, last question, and then we'll hop off of here. But Christian, if you want to start off, and then you can just pass the mic over to Bami. But, now that you do have 6 months into this thing, what are things that you hope for future residents coming through R2P that you hope they can get experience with, or you hope that they could get the ability to incorporate into the residency curriculum?
Yeah, absolutely. One of the things that we had discussed early on was the potential of adding research to our residency component. And just to be completely upfront, we had given it a go early on and realized that just with a lot of other commitments that we had as a residency program and things that we had already agreed to do, the time commitment was not going to be able to be there. And if you've done research, especially original research, you understand that is a significant time component and a significant time limitation. So we had given it a couple thoughts earlier in residency and then realized just with other things that we had committed to and other things that were our primary goals as a residency, that was not going to be it for us. So I think in its conversations we've kind of had behind closed doors of just seeing if we can get a research component up and off the ground, if that is of interest to the future residents, and seeing if we can do it in a manner that allows us to be successful as a residency program and eventually presenting at CSM or AMSC or potentially getting published, but also not allowing that to absolutely dominate our residency curriculum. Because I think one of the big takeaways from this podcast should probably be how diverse some of the experiences that we have are, and how flexible we can be with certain experiences. So anytime you take over a big component like research, that you run the risk of losing the potential for other opportunities. So I think that's something that would be great for future residents, if possible, if we can figure out something that works best.
Yeah, and I think mine is actually something that we're kind of in the process of doing now, but giving the residents the flexibility, if they don't want that much different variability in game coverage, the flexibility just kind of being out of college full time. And I think that's something that we're actually working on now. But that's probably the only thing. Also, other thing too is, for future residents coming in here, I always say, you're going to get what you want to get out of it. And I think that'll be my biggest advice to residents coming in here is that if there's an ask you have, ask Zach, and he'll probably make it work. So know what you want to get out of it, and feel free to make the most out of it you possibly can.
Yeah, transparency, open lines of communication, transparency. You are not going to hurt my feelings expressing what you want or what you're trying to get out of stuff when it comes to your career, and you've made the commitment to do a residency early in your career. So we will always be upfront. If it's something that we cannot make happen, we'll let you know why. And if it's something that we just have not made happen, we'll find a way to brainstorm and leverage our resources and network to figure out if we can make that a part. So I appreciate you guys being on here, sharing your thoughts. For anybody who is interested in residency or is considering pursuing it, you are always more than welcome to reach out to myself, Bami, Christian, Samantha, who was our residency graduate last year. And hopefully this gave you a little bit of insight as to what we do with our residency and what it looks like in general for the profession.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.